So I'm absolutely delighted to introduce the Shadow Minister for Primary Care and Public Health, an MP for Edgbaston, Preet Kaur Gill. Preet was the first female Sikh to be elected to the Houses of Parliament in the 2017 election. She's won many awards for her work, not least of which is so relevant for today's meeting, which was winning the MP of the Year award instituted by the Diversity and Inclusion charity Patchwork Foundation, who are here today as well. And she's recognised for her consistent championing of young people, the representation of the Sikh community, and her initiative to tackle fuel poverty via a strategic campaign aimed at the UK's biggest fuel companies. So Preet, you've got 5 minutes, no pressure, so sorry. And I know you're going to take a few questions after, and you're going to stay for the panel.
Well, good afternoon. It's a real pleasure to have been asked to speak here about Labour's vision for improving health outcomes in Birmingham and our wider vision for primary care and public health. The brief is, of course, very close to my heart, having served as a local councillor here, where I was cabinet member for public health and protection. It's great to come full circle back to health at such a critical time for our communities, but also our country. I know that the audience here is packed with practitioners, voluntary sector workers, experts and local leaders. It's great to see my colleague Robert Buckland here too, who are doing great work with and for the community, some of whom I know through my work as a local member of Parliament. I want to start by simply expressing my thanks for all the work that you've been doing over the past few years through a pandemic, industrial unrest and 13 years of neglect. This line of work has never been so difficult, while at the same time never more vital. I would normally start a speech like this by setting out the scale of failure this government has presided over when it comes to the state of our public services and the health of our communities. And I would set out the monumental challenge we face to get the NHS and the communities we serve back on their feet. But I'm not going to do that today. Not only because I know we're pressed for time, but because I know I don't really need to say any of that to most of you here, because I know that you see it, you experience it, and you have to deal with it every single day. 1 in 7 of us are stuck on waiting lists, patient outcomes are declining, improvements in healthy life expectancy are stalling, and some 2.6 million people of working age are out of work and long-term sick, a record high, and constituents pulling their own teeth out because they cannot get an NHS appointment. I could go on. And nowhere is unaffected by the Tory health crisis. But I might venture that actually here in our region, we've had it particularly bad. We went into the pandemic with record waiting lists, a workforce crisis in health and social care, and an NHS unprepared for the challenges of the future. And then during the pandemic, we saw how our diverse communities in Birmingham and Solihull were pummeled the hardest, how inequalities widened, and how disease preyed on the most disadvantaged and vulnerable. For most people, this was a wake-up call. How can we level up our region when healthy life expectancy lags years behind other regions of the United Kingdom? How can we draw a social contract with our communities when you can be 4 times more likely to die with the same disease for no apparent reason other than the colour of your skin? And how can we empower people to live longer, healthier, happier lives without addressing the social factors that determine those outcomes in the first place? For me, there are 3 fundamental reforms Labour will drive to improve the public's health. First, and most fundamentally, we must drive a prevention revolution. Secure jobs, fair pay, adequate housing, safe streets, clean air, accessible transport, free time, affordable facilities, nutritious food, and a fair society. These are all the essential building blocks for a healthy life. And as a result, they are the building blocks of reducing demand on our NHS. But for 13 years, there's been no joined-up plan for health. There's been an unwillingness to lead on issues like smoking, alcohol harm, gambling, childhood obesity, and services and institutions that promote good health have been run down. Public Health England scrapped the public health grant under austerity, always the first thing to be cut by councils under pressure. And as Patricia Hewitt said, and I have to agree with her, it's easy to argue, especially in the current climate of financial constraints and performance issues, that addressing these issues should be something that we consider when the current pressures have died down. But that has always been the case. The current government has chosen to play politics with public health instead of taking the difficult but necessarily long-term reform to shift focus upstream and reduce pressure on our health and care system, which Labour will. We will take tough action on companies seeking to exploit our children's health for profit. We will push for a smoke-free future, and our child's health plan with free breakfast clubs in every primary school will make sure that every child gets a healthy start to the day. And we will not make the mistake of conflating health policy with NHS policy. We will clean up our air. We will make work pay. We will retrofit 19 million homes, and we will work with you, the local leaders across the country who are rooted in their communities and understand the challenges they face to realise the potential of integrated care. A commitment to cross-Whitehall joined-up government and a proper partnership with local communities. I know the local ICS has already set out its 10-year strategy with a clear focus on many of the social determinants of health. So know that whether it's childhood obesity, tackling domestic violence, or the ethnicity minority pay gap, you will have a government that has your back. The second fundamental reform means making our NHS service a neighbourhood health service where more people can get care at home or in their communities. When it was created, the promise the NHS offered was treatment for infectious disease and short-term illness in hospitals. However, today, most of the NHS's work is treating long-term diseases such as arthritis, diabetes, and as people are living longer, the relationship between care and support for elderly people to be treated at home and preventing long hospital stays has become more and more important. We know that the NHS has not changed to meet these needs, and structurally we spend more money on hospital care relative to community-based prevention than any other European country. So we need to fix both the front and back doors to our health and care services. In social care, we will recruit and retain more carers to give people support in the community by introducing better rights at work, decent standards, fair pay and proper training that offers opportunities for progression. And under Labour, adult social care will be subject to a fair pay agreement collectively negotiated across the sector. And in primary care, we'll train thousands more GPs and cut the red tape that ties up their time. We will bring back the family doctor, and we will put mental health support in every school and hubs in every community, paid for by abolishing tax breaks for private schools. And to really make the neighbourhood health service a reality, we need you as a collective, people who know their communities, know your health challenges, know the primary care networks, the local services and the voluntary sector, the pathways, the roadblocks, the gaps. We want to support you and give you the space to get this right. Birmingham solutions to Birmingham problems. We can already see great innovation across the NHS. In Sussex, GPs work together, providing specialist and urgent care in the community, allowing patients to see their regular family doctor and giving them greater care and control over their own care. They are preventing 4,000 patients from having to go to hospital every single year. In Cheshire and Merseyside ICS, they are now tackling winter fuel poverty by cross-referencing deprivation and fuel poverty data with COPD and asthma and multiple admissions. So community respiratory teams can get out to these patients and make sure that they are getting the winter fuel payments and all of the other support that is required for them. When Birmingham has some of the worst fuel poverty in Europe, let alone England, is that something that we should and could be doing here? I'm really keen to hear from you today about exciting new practices that you are pioneering and how government can help you go further and faster. And finally, we need the workforce of the future to make this change real, armed with the technology that they need. And we've already announced our Fit for the Future Fund to arm the NHS with the state-of-art equipment and new technology to cut waiting times, doubling the number of MRI and CT scanners over 5 years. And we will deliver the biggest expansion of NHS staff in history, more GPs, more district nurses, more health visitors, more midwives. And we've announced our dentistry rescue plan, funded by abolishing the non-dom tax status to deliver 700,000 extra appointments each year, get more dentists into the communities that need them most, and make sure that everyone who needs an NHS dentist can get one. No part of the system can afford to be neglected because every part depends on the rest. This week we learned that the Tory crisis in dentistry has contributed to a 46% rise in mouth cancer deaths compared to a decade ago. That is heartbreaking. None of us accept that for any of our communities, and the next Labour government won't. Our 10-year plan of change and modernisation will shift the focus of healthcare from the acute sector into the community to boost prevention, diagnose conditions earlier, and provide treatment closer to people's homes. So sickness to prevention, hospital to community, analogue to digital. We want to fix the front door of the NHS and take pressure off our hospitals and GPs by joining up more services in the community to expand self-referral routes and train up a neighbourhood workforce of health visitors and district nurses. Working together, we can pull our communities out of crisis and restore the NHS to good health. Thank you.